this is a phase 2 open label clinical trial, so every patient got the same therapy. And it included patients with relapsed and refractory indolent B-cell non-Hodgkin lymphoma, and specifically two subtypes. So it included follicular lymphoma as well as marginal zone lymphoma patients. The planned accrual was 125 patients with follicular lymphoma and 35 patients with marginal zone lymphoma. And the data that was presented at ASCO was from all 125 patients with follicular lymphoma and 16 patients that were treated with marginal zone lymphoma. And so hence the interim analysis. And so all these patients were in their third line or beyond in terms of their treatment, and their prior treatments must have included chemoimmunotherapy with a CD20 antibody and an alkylating agent. And the median number of prior lines of therapy were 3. So most patients actually had 4. This was their 4th line of therapy. I think 70% of patients had 3 or more prior lines of therapy. So so it's a heavily pretreated population. In addition, it was a high-risk population. It was a high tumor, patients had high tumor bulk by Guelph criteria. They had a high-risk FLIPI score, like I said, they were heavily pretreated. So, and the number of patients who had progressed early after their first line of therapy within the first 2 years also approached 50%. So, a particularly high-risk group of patients.